And welcome to the Dr. Bob Show. How healthy is your heart? Are we doing a better job in keeping hearts healthy? Do you know what it takes to have a healthy heart? Do you know what a STEMI is? S-T-E-M-I? Do you know which artery of the coronary arteries that supply the heart are the widowmaker arteries? Do you remember what the typical pain of heart attacks are for men and for women? We'll review some of those. My guest is Dr. Malcolm Foster. Dr. Foster is a board-certified cardiologist. He answers these questions every day. Hello, I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we're going to be talking about how to prevent getting diabetes. And if you have diabetes because you're overweight or you haven't paid attention to your health, how to get your diabetes under better control. It's going to be a lot of information for you. You'll want to stay tuned. We're talking with Dr. Malcolm Foster, board-certified cardiologist, and we're talking about how we're doing as far as our heart health goes. Malcolm, welcome to the Dr. Bob Show.
Thank you, Dr. Bob.
Are we doing better in preventing heart attacks or getting people better? What are the statistics?
We are doing better. We're making progress. We've identified risk factors. We're reducing smoking. And our treatment of heart attack has become more effective.
So we really are doing a better job. Are we doing a better job in men or a better job in women?
Unfortunately, more so in men than in women. Women, our success rate is not as good.
They're more difficult, is that right?
They are.
As far as their pain goes. And
yes.
So it may be more nondescript, and we'll hopefully get into that. So risk factors for somebody getting heart disease and routine symptoms. What are the routine symptoms that people get with a heart attack, the classic ones?
Right, so the classic symptom is chest discomfort. So tightness, pressure, heaviness in the center of the chest.
So it's right in the middle, but the heart's over on the left, but the pain's right in the middle.
Right, yes,
yeah,
sir.
It's like, some people say it's like an elephant standing on your chest.
That's
and
correct.
Always,
a heaviness, a pressure, a tightness.
How about women?
Well, they can have classic symptoms, but oftentimes they don't. They might have shortness of breath, they might have nausea, they might just have fatigue or exhaustion and not realize that it's the heart.
Do they know something's going on? Is there, if women, or it may just be vague symptoms, break out in a sweat, feel short of breath?
Yeah. The other problem is that women oftentimes have obligations. They are taking care of families, spouses, and family members and children. And so women, unfortunately, come in a little late, have a later presentation when they come to the emergency department with their heart attack.
Whoa. What risk factors? Who's a candidate for getting heart attacks?
So the typical risk factors are high blood pressure, high cholesterol, high sugars, diabetes, and smoking.
So those are all things we can do a pretty good job with.
Yes.
We can control diabetes, we control high blood pressure, we can certainly stop smoking.
That's right.
Does smoking damage the blood vessels? What does it do?
It does. There's an interaction with plaque buildup, which is typically cholesterol plaque buildup, and damaged arteries from smoking, and that makes them very vulnerable or susceptible to causing a heart attack.
So in our current age, I'm seeing millennials that are really doing a good job of trying to prevent getting heart disease and heart attacks. So the risk factors, if they try and prevent those, so what do they do about high blood pressure?
So first, it's very important to check blood pressure. People have a sense sometimes that they can tell when their pressure is high, and that's not really true. So you really do need to check your blood pressure. Get a blood pressure cuff if there's any question, and check frequently. So to get to know your numbers, know what your blood pressure is. know what the cholesterol level is.
Normal cholesterol, do we worry about the total or the HDL or the LDL or all these DLs and the APOs now?
That's right. Well, there's good and bad cholesterol. And so the bad cholesterol, like LDL and triglycerides, we want to get those low. The good cholesterol, the HDL, we'd like to see that boosted up.
So how do we lower the lousy cholesterol, the LDL, and how do we raise the HDL?
So for sure, healthy diet, exercise, an optimal weight, keeping your weight down, those are all very important for everyone.
So we mention those all the time, but they're really, really important, aren't they?
Very much. That's the foundation.
So is it easy for somebody to recognize if they're really overweight? Where does the waist size come into that?
That's very important, because if you step on the scale, or if you look at a chart, height versus weight, you can look at a chart and get an idea.
Well, but I'm muscular, I'm lifting weights, and so it doesn't mean anything to me.
Right.
So it's a 40-inch waist, is that?
That's a big risk factor for men, and I think a 36 waist for women.
Yes. And so women, we give a little bit more leeway on that. And they certainly have littler waists. Everyone I see has a size 22 waist. That's sort of ideal. And that means a lot to them, because why is the belt size important? Why is that part of the body important?
Well, we call it central obesity. So the gut and the central, the fat, both superficial and then around the organs. So we call it visceral fat around your vital organs. And how much fat around the middle is really predictive of that.
So if you've got fat around here, you've probably got fat around the vessels in your heart, and you're asking for trouble. It's said, well, I've just got these love handles. Well, love handles are hard to get rid of. However, that core fat is really something we have to pay attention to.
Absolutely.
Diabetes, blood sugar,
so
A1C.
Yes, sir. So same thing. Unless the blood sugar is very high, most people do not have symptoms. So it's important to get a finger stick or get a blood draw and to have the blood sugar checked.
So if people get diabetes, and I'm going to be talking about this later on in my question and answer, there are things that they can do to get their diabetes under control and to prevent diabetes. So I'm going to be talking about that later on.
Good.
Anything else? What about exercise? How important is that to people to stay healthy and get their cholesterol and blood pressure under, get everything under control?
It is essential, and it helps everything.
Sleep?
Sleep is very important. And for example, we see lots of patients with sleep difficulties like sleep apnea, and that is a significant risk factor for heart disease.
So if somebody has sleep apnea, that means they stop breathing, the oxygen level goes down, the heart gets irritable. You can have heart attacks at nighttime because of that?
Correct.
And if you get the sleep apnea under control, then you've got a good chance of improving your risk factors.
Absolutely.
So there's so much we can do.
Yes, sir.
Do you have to spend a lot of time reminding people on those things?
We do. This is a lifetime of advice. And they say, well, if I want to do one or the other, I say, no, it's a whole package. You have to do the whole thing.
So if I've got crushing chest pain in the middle and I run into your office in the next 5 minutes because I was running right by your office, is there physical findings on physical exam of somebody that's having a heart attack?
There are some findings. The heartbeat can become irregular. Sometimes there can be fluid on the lungs that we can hear with a stethoscope. So there are some findings with a heart attack.
And you draw blood for what?
We check for an enzyme from the heart that with a heart attack, it releases an enzyme fairly quickly.
What's it called?
It's called troponin.
Okay, so we got troponin, and then you get an electrocardiogram. Is an electrocardiogram hard to read?
No, it's actually fairly easy to read for a heart attack.
And are there things you can see on the electrocardiogram with a heart attack?
Yes.
And that's what we're going to be talking about when we come back. I think we're going to teach you how to read an electrocardiogram, what all the blips mean, and what a STEMI is on an electrocardiogram. This is going to be really fun. You'll want to stay tuned. We're talking with Dr. Malcolm Foster, board-certified cardiologist, and we're talking about, are we doing better in preventing heart attacks? Yes, we are, both in men and women. Men a little bit better than women. Women have different symptoms of heart attacks sometimes. Usually it's the standard crushing chest pain right in the middle of the chest, and it can radiate. But women sometimes can just have vague shortness of breath, break out in a sweat, not feel good, know something's going on, or maybe don't know. And they're caretakers, and so they're used to take care of other people, not themselves. So we talked about the risk factors, we've gone over those, and then we talked about the diagnosis, physical exam. Sometimes you get fast heart rate, sometimes you do this and that. And then we talked about electrocardiogram. So first of all, Malcolm, what is a STEMI, S-T-E-M-I?
So a STEMI is a full-blown heart attack. And on the electrocardiogram, that is ST, elevation, myocardial infarction.
So ST segment elevation during those are big medical words, but let's look. Let's look at this electrocardiogram right here, and tell me, is that normal or abnormal?
That is a nice normal PQRST, nice normal electrocardiogram.
Okay, so tell me what the P and the QRS and the T mean.
So the upper chambers of the heart, the atria, the P wave, as it depolarizes or changes, that's when the upper chambers are contracting.
So that's electrical activity, I think, that you're seeing right there. And as it depolarizes, it's that electrical charge. You get that little blip. The first one is a P.
That's right. And then the spike is a QRS complex, and that has a lot more voltage. It's a big spike because the ventricles that have the heart muscle, that's when the heart muscle is contracting.
That's the big pump that's right there.
Yes.
That's where sometimes the heart attack occurs.
That's right.
Okay, and then what's the T wave?
So that's when the heart relaxes between heartbeats. So we call it diastole.
Okay, now let's look down at the bottom, and this is very important, with the ST segment.
Yes.
Now, all those are on an even line. Let's show electrocardiogram number 2. And then we're going to go back to number 1 again. Let's go back to number 1. Okay, so let's talk about the ST segment.
Yes, so that ST segment is flat. It's at baseline, what we call isoelectric.
And so that's where you want it to be, normal electrocardiogram.
Yes.
So STEMI, ST segment elevation with myocardial infarction, with a heart attack.
That's
so
right.
Let's go to show me the STEMI.
Yes.
Now, what do you see there?
Oh, that's a very typical appearance of an acute heart attack, a heart attack that has just happened. It could be within a few minutes even, and it would show ST elevation.
So you can see the P wave.
You see the P wave.
You see a QRS.
Yes.
And then the ST segment is elevated way high.
Correct.
Dangerous sign.
Correct. And the T wave is very peaked. So that's a very characteristic appearance with a heart attack.
So if you see that on an electrocardiogram, what do you know? They're having a heart attack.
So we, all hands on deck, we call it a code STEMI. So we activate all the resources. For example, that tracing may be taken from an ambulance. The paramedics in the field, they can come to someone's house and they can see that and they can transmit to us in the hospital, and we know ahead of time that this is a STEMI, this is a heart attack.
STEMI code.
That's right.
And so that's why it's important to call 911, get the ambulance to come, because they can get the information ahead of time.
Right. You really don't want to drive your spouse to the hospital having a heart attack. Call 911. Very important.
Yeah, and I think we can't stress that enough. Very, very important.
Yes.
Call 911 because they've got facilities to do that.
Correct.
So in the ambulance, they can get an electrocardiogram. What else can they do?
Well, they assess the patient, so they start an IV, they can give oxygen, they can give medications. So they can start treatment before they ever get to the hospital.
Under the doctor's guidance or under their protocol.
That's right.
So it's important that when you have that chest pain, that you get to the hospital in 90 minutes. Why? What are you going to do when you got code STEMI?
Right. A code STEMI means a closed artery, and we want to get that artery open. An open artery is what saves heart muscle.
So how do you do that? They come in, you're ready for them.
That's right. We take patients 24/7 to the cath lab, the cardiac cath lab, and we do an emergency catheterization, and we usually use balloon and stent and open up the artery.
So tell me what that's like. They come in, crushing chest pain, you rush them
We do.
right up to the cath lab, and you're going to have to insert a catheter, and in that you're going to have to do a stent. Tell me about that, and then the balloon first, and then the stent.
Sure. So we do that, and we just, anywhere there's a pulse. So for example, in this area, or nowadays even from the wrist, the catheters are so small that where you feel the pulse, we go in and we thread that back to the heart. We give x-ray dye. We can see the blockage where it's blocked, and we can open up the blocked artery.
You can do that quickly.
We do that in less than 90 minutes, typically less than 1 hour, less than 60 minutes.
So the radial pulse that you're talking about, I always tell people there's a little bone there, and then there's a little ligament there, and right in between the two is everybody should know how to take their pulse.
Right, you take your pulse there, and we can do the heart catheterization from
Same
the radial.
place.
Yes, sir.
And that goes right into the heart.
Yes.
Okay, now when it gets in the heart, what's it like putting in a balloon and then the stent? Tell me what you do.
We start with a very delicate wire, and we thread that and steer that through the area of blockage, and then we use that to deliver our tools. Sometimes a suction catheter, sometimes a balloon, sometimes a stent.
Are there getting more and more advances of what we can do when you get in there? Or tell me about the stent. I call it a sophisticated slinky.
That's basically what it is, and they've gotten better and better and better year by year. So we're in about our 8th generation of stents, and they're more easy to deliver. They do a better job. They're very dependable.
And so sometimes those stents will reclog up, and so you do what in the most recent?
Right. So if a stent has re-narrows, usually scar tissue, we have ways of cleaning out the scar tissue and reopening the stent.
Do you put any radioactive material a little bit at the end of the stent so
That's
they don't
one of
clog
the
up?
options. Yes.
So you've got lots and lots of options.
Yes.
So here you had a patient that was essentially dying, ready to die.
Correct.
And what are they like when they get them off the table and they've got stents in there?
So they come into us pale, gray, in distress, and usually they leave out pink and warm and happy.
When they have a stent, they get pink and warm and happy.
Right before our eyes, literally right before your eyes.
What do you tell the patient then? Go out and play golf? I'd be scared to death.
Yeah, so they have to recover. They have to heal up and recover from the heart attack, and we caution them that they have to give a little bit of time for recovery and to start to change those health habits to protect them from future heart attacks.
You know what I like about it sometimes it's a wake-up call. Mm-hmm. Sometimes people say, I'm not going to do this. And they get that heart attack and they come in pale and they leave warm and happy. I like those words.
Yes.
Then they say, time for me to look at my risk factors, time for me to get well, time for me to work out a program with my cardiologist. You guys are great.
Oh, thank you.
I mean, it just makes me break out in goosebumps when I think about leaving warm and happy. Mm-hmm. Malcolm Foster, you're a great, great teacher. Thank you. And I hope that we can talk again about rehabilitation, what you have to do again when you get off that table and you're warm and happy. It's just starting a new part of your life.
That's right. Thank you, Dr. Bob.
Great, great, great information. I've enjoyed it thoroughly. And I've learned a lot, and I hope you have too. Now we're going to be talking about diabetes, one of those things, what we can do to prevent getting diabetes, and if you have type 2 diabetes or type 1 diabetes, what you can do to take charge of your diabetes. A lot more interesting information for you. I want to thank Dr. Malcolm Foster, board-certified cardiologist. Wonderful discussion on how we doing. Pretty good, and boy, are those guys sharp. Now, question from you, the viewer, that I think will be important to your health. Question number 1, Dr. Bob, I need to get my diabetes under control. What should I do? Well, let's talk about diabetes. We've got an epidemic of diabetes, actually. And why that is because there's an epidemic of obesity. And when you get overweight and when you get to be obese, then there's what we call insulin resistance. Insulin doesn't work. So we've got to figure out ways to make the insulin work to help metabolize the sugar into the cells so we'll have the energy. If the sugar floats around in the bloodstream and gets too high, it doesn't do any good. But it gets higher and higher because it wants to. The body wants it to get inside the cells. So what can we do? Number one, if we exercise, and that means getting out and exercising for 30, 45 minutes, maybe 5 days a week. As you're exercising, it makes the insulin less resistant. It makes the sugar go into the cells where they can then work. And that helps lower the blood sugar. So that's another thing that we want to do to get your diabetes under control, is know what your blood sugar is, especially your hemoglobin A1C or your A1C, because that will tell you what your blood sugar has been over about a 3-month period. So you can't cheat and not eat very much the day before you see the doctor, because your blood sugar is going to be what it's been for the last 3 months. So your A1C should be 517. If it gets over 6.1, it's too high, and you got to work to get it down. So you've got to eat better foods. So more fiber in your food. So read the directions on the food that you eat and see how many grams of fiber. You should get a total of 25 during the day. Well, what does that do? Well, if you get more fiber, as the fiber goes through the digestive tract, it will actually pull cholesterol out. And that's one of the things that we find when we have diabetes, that our cholesterol, the bad cholesterol, the total cholesterol, our blood fats get worse. And if you eat fiber, then it will pull the cholesterol out. There are medicines that we can take if our cholesterol gets too high. So know to talk to your doctor about those. And then you need to get a plan where you don't eat fad, F-A-D diets, that you get on a regular diet where you're eating good foods, where you're eating more fruits, more fibers, more whole grains. So whole grains is one of the things we can do. We don't necessarily know how the whole grains really work, but they definitely do work in help controlling metabolism and making it where your diabetes goes away. What can we do to prevent diabetes? Lose weight, lose that core fat that we talk about, exercise that makes the insulin work better, eat the proper foods, and you'll be doing a great job of getting your diabetes under control. Now, that's all the time that we have for this show. Now, remember, the 4 things that we like to talk about with every show. Number 1, it's exercise. So what does exercise do? Well, exercise will help control stress. It will help you lower weight. It will make you feel better. You'll have a runner's high. It makes it where it may be the most important thing you do, because when you exercise, you feel good, and you recognize the need that you'll have to go exercise more. You'll want to exercise. There's little areas in the brain, they're called little happy pop-up cells, and those endorphins and kephalins, that they activate because we exercise. And so exercise will be an important part of your regular activity. Be sure we get 7.5 hours sleep. If we don't get 7.5 hours sleep, we don't feel good, we don't perform well. If people get sleep apnea, then what happens with sleep apnea? The oxygen levels goes down, the heart becomes irregular, and you can get runs of beats. And also, because of sleep apnea, of snoring, of loud snoring, it actually makes insulin resistant. So the insulin doesn't work again, and so we gain weight. And when our blood sugar is real high, we want to eat more food. So we get, actually, it's a vicious circle. Well, we don't sleep, we get insulin resistance, and then we gain that weight that we try so hard to get our weight lower. Eat properly, Well, you know, we all know how to eat. And I think the biggest problem is we need to learn to eat less and exercise more. So there's a lot of things going on. Most recent things, there's got some science behind it. And that's starvation of 12 hours. So what does that mean? Well, your last meal is, let's say, 6 o'clock at night, or last thing you eat, 6 o'clock at night. And then you've got 12 hours until 6 o'clock in the morning where you need to wait before you eat again. So a 12-hour fast, if you'll think about it, is not as hard to do if you eat and don't eat right before you go to bed, and you don't eat the minute you get up. So be sure there's 12 hours between those two. And there's recent statistics that show that 12-hour fast may give you a longer life. So eat breakfast, lunch, and supper, have a 12-hour fast, eat less food, no meats, eat good foods, foods that are not meats, not red meats, more protein foods. And most of all, what is it we want? You know, it's that laughter in your life. Your immune system works better when you giggle and when you laugh. You'll get less colds when you giggle, when you laugh. So if you giggle and laugh, we know you'll stay healthier and happier.